Tipp FM investigates. Funded by the News Reporting Scheme. The health of Tipperary.
When you're out with clients and you're out with families and you see how much they're trying to do, and it's like you really want to be able to provide the level of service that you can, and unfortunately we just don't have enough resources to be able to kind of do it.
That is Majella Broader's Clinical Operations Manager at Care Plus Waterford and South Tipperary. She manages a team of carers based in Clonmel. And Majella, would you like to tell us a bit about your role and the role of Care Plus in Tipperary?
I manage a team of carers that support clients living in the community, and we work mainly for home support service. We also cover agency staff working in residential settings across the region. Predominantly, we work in home support services, and we provide both private services to support people living at home, and we also offer services that are paid for by the HSE as private providers, covering home support services.
Have you noticed added pressures on Care Plus recently or in recent years?
Yeah, I definitely feel that there's challenges in providing home support services. Ireland is definitely facing a deepening crisis in home support services, with new data showing both soaring demand and shrinking workforces. National waiting lists for home supports have surged by 13% in just 1 year, rising from 4,805 to 5,406 people waiting to be assigned a carer. Of those waiting, 2,198 are new applicants that are waiting for care to be provided in the community. And there's a further 3,200 are existing service users seeking additional hours that cannot be provided. The pressure is particularly acute in rural regions where recruitment and retention challenges can be a problem.
So would you think rural areas are affected more across Tipperary?
Yeah, I definitely think it's harder in rural areas to provide a service. So we have clients that routinely will be coming to us asking for a service, but we mightn't necessarily have carers in that area. So that definitely is a challenge. And that's a challenge that's echoed across, with my colleagues, because we collaborate a lot with other private providers and we work very closely with the HSE to try and optimise services. And that's definitely a challenge where people in remote areas, it's harder to get services because there's lack of carers in that area.
And what impact does that have on the care that can be given to service users?
The carers, obviously, if they're travelling further to provide a call, that it means that they're travelling longer, and very much we'll say for home care at the moment is based around task-focused care. So it's providing a shower or helping somebody get up or whatever. So it's very time restrained. So you literally might have 30 minutes or 45 minutes to perform a task or to provide somebody with the support, maybe to have a shower, get out of bed, or a medication prompt. So if you're travelling, if a carer is travelling for a long time, it can often mean, especially in areas like Tipperary, that they're travelling longer than they're actually with the clients.
And what would you say is contributing to these strains affecting Tipperary?
I would feel that we definitely have a lack of resources, a lack of carers in the area. So that means that a client might come to me and they might say, oh, I'm approved for 10 hours a week, but we mightn't necessarily have the staffing for that. So that's a huge problem where we might only be able to provide a certain amount of the care to the person. And we might have to be prioritising care to earlier in the week that maybe family might be able to pick up then at the weekend and things like that. So that's definitely hard when carers aren't able to provide the level of care that the client needs. I also find that clients are sicker, they're more frail in the community. Clients definitely want to be at home. We want clients to be at home. It's a lovely role being able to provide care for somebody in their community. It's not many jobs where you're welcomed into a person's home to provide that care. So that aspect of care is lovely. But definitely carers are under time constraint to be able to get the task done within the allocated time and then to, move on to the next client. So that definitely is a challenge. Our goal is to be able to provide person-centred care, but when you're under time constraints, that definitely makes it more challenging. For example, say if we go into somebody that might have dementia, they need time to be able to process what the tasks that they need to do, and the time pressure definitely is a challenge when you're trying to support the person, give person-centred care. So that is a huge challenge.
And how does this affect families, and how can care support families?
I meet so many families, and they're delighted to be able to get the support. They could have been on a wait list for a while, or the application process might have taken 4 to 6 weeks to be approved. So once they're kind of meeting you, they're delighted that they're being able to get the care, but then they're realizing that it's only for a very small amount of time. So it's like 45 minutes, and you're trying to manage the expectation of that care within that time frame. So generally, people would come to you. We would have a lot of clients that we would offer private care as well in conjunction with the HSC care, so that we're able to facilitate a better level of care for the client.
Is there enough support for carers?
Carers, healthcare generally is paid poorly. I think we try to offer a high level of support here within the office, in that I support the team. We also have a CNM and we have a field care supervisor to try and offer that support. But I think caring at its very nature is very challenging. I see carers go over and above every single day. The bond that they have with clients is just amazing. They give so much to their care, that it is important that we as the management team are able to support them as well. But it's definitely a very rewarding career, but it's also very challenging in that you see so many people going through such, some hard times. We don't just cater for older people, we also cater for other people with different levels of disabilities. We also have a team of nurses that are supporting advanced care clients that need more specific high-tech care. So it's supporting that range and level of people across the spectrum.
And does that have effect on other services or the hospitals?
Hospitals have already warned that patients who are medically fit for discharge are remaining in hospital beds simply because no home care package can be secured. Today alone, 10 patients in Tipperary University Hospital are medically fit for discharge but remain categorised as delayed transfers of care, with the lack of home care support likely to be a contributing factor.
What effect would staying in hospital have on patients or service users?
Well, unfortunately, the longer a person is waiting to come home, it affects everything. It affects their mental health, it affects their frailty, because obviously in hospital they're unable to move around, whereas at home they'd be able to be pottering around in their own environment. So from every part of their well-being, it's enhanced by being at home. So every day that a person is in hospital longer, it's taken that opportunity from them to be at home, be well, be with their own people. So yeah, it's hugely important to get home as quick as possible.
So it's just so crucial for people to be able to stay at home.
Absolutely crucial. Every day across Tipperary, there's hundreds and hundreds of carers supporting clients to live at home. And that's whether it's helping them get out of bed in the morning, supporting them with personal care, with washing, medication prompts. There's hundreds of carers supporting people all across Tipperary. It's just vital. There's so many people. There's some of our clients, the only person that they actually may see is actually their carer that day. Some people are so isolated across the country. The carers are just vital in providing that support and that link to the community. We also provide an awful lot of dementia support hours, and that's hugely important because it kind of moves away from the task-focused care, home care model. And as part of the dementia model of care, we provide a huge amount of support for clients with dementia across the country, and that enables us to give 6 hours care to a client and a family member that is struggling with dementia. And these 6 hours are really looking at the client with dementia from a holistic way, supporting them by improving their quality of life. We do activities, we do tasks, we do pamper sessions, and it's a lovely way in which we're able to provide home support and provide care outside the task focused of home support.
And is your service means tested?
It isn't actually means tested. The public health nurse generally goes out and does an assessment of needs, and then that is then sent off to the home support office, and then they provide then the care, whether it's provided by the HSE or it's offered out then to the private providers.
But are people entitled to that level of care?
Unlike nursing home care, under the Fair Deal scheme, there is currently no statutory entitlement or legal right to receive home support in Ireland. Many families are forced to supplement HSE hours with privately funded care.
What supports do you think need to be put in place to help carers across the county, as well as families in Tipperary that are looking to use caring services?
I think a proper workforce strategy would be great, to be really looking at home support carers and supporting people to start a career and a role within home support. Making it more attractive for people to work in home support is really important. As part of Sláinte Care, we want people to be living at home. People want to be living at home. And I suppose it's important that we really look at the workforce and how we're going to be implementing that. Like, if our age profile of people over 65 is going to nearly double in the next 15, 20 years, but yet our workforce is reducing, these don't line up in that we're going to be able to provide care for people going forward. So we need to be really looking at it and how we're going to be able to address it going forward.
Across the board, all forms of care are being affected by these issues. Richie Malloy is a local county councillor with over 20 years' experience working for family cares. Have you noticed a shift in the pressure on carers in Tipperary recently?
Family Carers Ireland has noticed huge pressure on family carers, in the last couple of years, and certainly in the last couple of months, because of the way the oil crisis is going. It's put enormous pressure on family carers, especially carers living in, say, rural areas that rely on home heating and that. Like kerosene, for example, has literally doubled in price there in the last couple of months. And you have to remember all the time that carers that are lucky enough to qualify for the carers allowance, the carers allowance is only €237 a week, which is quite small. It works out at something like 150 an hour. So nobody can accuse up to be a family carer. It's just something that happens, the mum, the dad maybe gets sick, or maybe you're a child with special needs, and the next thing you know, you're the family carer.
And is family care based off a means test system?
Yeah, unfortunately, the carers allowance is still means tested. The present government have promised to abolish the means test in the lifetime of this particular government. So it has improved, the disregard for the means has improved in the last budget, so it's not as tight as it was a couple of years ago. So that would be the one area I would say that has improved, and it's not as hard to get the carers allowance now because of means. You're allowed quite a generous disregard of your means. The biggest issues kind of facing carers today really are the cost of living is huge. Lack of services now would be a big one, lack of home helps, that type of thing, therapies. There's big, long waiting lists for those, and that seems to be getting worse as time goes on. The 237 a week is very small. we're saying it should be at least brought up to, do you remember the COVID payments were 325? So we're arguing that the carers allowance should be a minimum of 325 a week, and that would go some way towards making it easier to keep the person at home.
And how would that affect carers and the care that they're able to give?
What really happens is, and say I'm working with family carers literally over 20 years at this stage now, but what I've seen from carers that, generally family carers that are, certainly carers that are caring on a 24/7 basis are just really exhausted. And what happens is if they don't get the proper resources from government, they end up putting their loved ones into full-time care a lot sooner than need be. They're putting them into nursing homes, and nobody really wants to go into a nursing home, but sometimes the resources aren't there to keep the person at home, and that's enormous costs to the state.
And as someone who works in family care and as a local representative, what are you doing to approach these situations, and what is a priority for you right now?
I continue to lobby government all the time to impress upon them how difficult it is for the ordinary family carer. And over the years, I suppose, I would have been probably successful maybe in getting meetings with different government ministers, I suppose, to bring carers too. I was very happy there, I suppose, that we started this family carers choir in Clonmel there in the last 12 months. And that was something kind of unique for carers, that they kind of had a space of their own, and they formed this carers choir, so they meet once a week. And that, because a lot of carers are very lonely out there, I suppose. I think by giving carers a listening ear would be part of my role, and I suppose I do organise a lot of events.
Yeah, and what do you need from government right now? What do you think they should prioritise?
In this common budget, I'm calling on the government. I put in a motion actually at Tipperary County Council there recently, calling on the government to exempt the carers allowance from being taxable, because that seems kind of crazy to be taxing carers on the carers allowance. It has been the practice since it was introduced, but I was happy that the motion was passed unanimously by Tipperary County Council, calling on the Minister for Finance in the upcoming budget to exempt carers from income tax, and as well to rise the carers allowance from the 270 to 325.
That is all we have time for today. Thank you very much to Richie Malloy and Majella Broaders.
Tipp FM investigates. Funded by the News Reporting Scheme. The Health of Tipperary.